Eastern Cape and the Western Cape seem to be at or past their peak. Those are the findings by Medscheme's hospital admission analysis. The Health Risk Management Services provider and medical administrator has been comparing the first COVID-19 peak in July to the current wave that's gripped the country. Let's get more now from Medscheme's Managing Executive for Clinical Risk and Advisory, Dr. Lungi Nyati. Dr. Nyati, good morning and thank you very much. The numbers from the data that you are getting are showing that there's going to be more pressure on the hospital admissions, on the healthcare system. Which parts of the country currently are bearing the brunt of the second wave?
Hi, Dan. Very great to be here. We've seen the biggest number of cases in KZN, Western Cape and Eastern Cape, in line with what the NICD have been showing. However, we think that the Western Cape has reached its peak, although their numbers are definitely higher than they were in the first peak. And then in the Eastern Cape, we also think they're probably at their peak, and they didn't get to the same numbers as in the first wave. However, what's concerning to us now is that we're seeing still more than 10% increase every day of cases in KZN and now in Limpopo, which actually was doing very well in hospital admissions up till now.
And Gauteng, with the mobility issue that we keep on hearing about from the medical sphere, to say that people have been away during the festive season, they are now coming back. We are seeing those queues, for example, at the Beitbridge border with many people returning home.
Yeah. So, I mean, I do imagine that in the next few weeks, we are going to see a different pattern emerging as people start moving. But as present, Gauteng is still well below what their peak was in the first wave. And so we'll remain to see. But I do think that the next 3 weeks are likely to be very indicative of where the second wave is going. And certainly are concerned about the number of cases that are still being admitted into hospital. So it's important for us actually to be putting all our work on working with government to get the vaccine, because that's probably going to be what the next best thing is going to be for us, other than decanting the hospitals.
Yeah, and we're all waiting for the news about this vaccine. The government saying it wants to start in February, and there's a lot of skepticism around that. Do you share it, the skepticism?
I do not share the skepticism. I do think that a lot of work still has to be done. We are really working tirelessly with the NDOH to see how we can secure enough vaccines to be able to cover at least 65% of the population. And so we're working on ways that, and segmenting the population, should I say, to make sure that we are clear on what will be covered by the government, what can be covered by medical schemes, and how can medical schemes assist, as well as what corporate South Africa can assist. And so we seem to be making some progress on what we think may be a viable funding strategy. And so I don't share the skepticism.
You sound very optimistic, which is good to hear from a medical practitioner, somebody who's in that sphere. But just before I went on air, Dr. Nyati, I was talking to our duty editor, Peter Mutlowitz, and we're talking about this vaccine thing and the kind of speculation and rumors that the new strain, the new variant of the coronavirus might not respond to a vaccine, or a vaccine might not be that efficient and effective against the new strain or the new variant. Any truth to those rumors?
Well, we don't know absolutely at the moment, but from what the scientists have been seeing and have been discussing with us, it does look like the current vaccine should be effective even with the new variant. However, with all vaccines, we have a flu vaccine every year because all viruses mutate. And so there is work already beginning with some of the pharmaceutical companies who are working on vaccines to see how they need to tweak the current vaccine. But as we currently have it, it does look like the current vaccine should be effective even for the new variant.
Okay. Now, the private sector's responsibility, you've mentioned that you are talking to various stakeholders. You are also seeing how you could assist as a medical scheme. What is it that you believe that can be done by the private sector, the private medical sector, to assist the strained public healthcare industry as we're seeing these increasing numbers currently?
Sure. You may not know, but in the Medscheme population, we look after 3.9 million lives. And that's a significant number of lives in the population. We have in our scheme population members from GEMS and members from PolMed, which represent already a large proportion of the country. And we're doing a number of things. One of the things that we're doing is that we've got a hospital at home initiative where we are decanting the hospital so that patients who can't be safely treated at home, even though they require hospital level care, can get that at home. We're working also with the specialists and the hospitals to make sure that we identify patients early and that the healthcare workers who are in the private sector can be mobilized even between provinces to be able to assist the healthcare workers that are already tired. Also, in our group, we've got nurses that are on the ground that do see some of the high-risk patients from their home where they require care. And then we look after over 700,000 patients with HIV, and we deliver medication to them. And I think that as we move down the line, as more and more is required in terms of distributing both medicines and vaccines, we will be able to use that distribution channel. And so I think that there's a lot that the private sector can assist not only in procurement of vaccines, but in giving treatment right now to the sectors.
I'm going to be in trouble with my producer, Zama, just now, but I need to ask you this. If you compare the first wave and where we are currently, knowing what you know from your data as Medscheme, are things worse now than in the first wave of the coronavirus infection? Because in other parts of the world, the second wave has been far worse.
We're not yet at worse than the first wave, but we are reaching there. There is a geographic distribution that's different, very different this time than it was last time. And we didn't see as many cases in Eastern Cape and certainly not in provinces like Limpopo in the first wave. So some provinces will definitely be more under strain than they were in the first wave. But overall, we haven't reached the peak of the first wave.
Thank you very much, Dr. Nyati from Medscheme. Now,